Welcome to Mad Medicine with Miss P, and another episode of Why. Why? I don't understand why. Okay, for instance, if you are in the waiting room for anything, a dentist appointment, a doctor appointment, surgery, and someone calls your name, respond to them. Hold your hand up, wave them down, let them know that in the crowd of people, you are the one that needs to be going back with her. Because it's really weird when I call the name and no one is looking at me and I'm loud and I didn't mispronounce it. Smith, Miss Smith, nobody's responding. Mr. Walker, I'm looking into faces and no one's responding. And then eventually I see someone starting to put their purse on their shoulder and I'm like, oh, are you Miss Walker? Mm-hmm. Why didn't you answer when I called you 5 minutes? I've been standing here looking at you. What is happening? I need to go. It's time to go. I don't understand. I don't understand. And every time it happens, I'm just like, again, this is happening again. And I'm loud. I mean, do you think I whisper? I'm loud. And even if I mispronounce it, surely you've had your name mispronounced often enough to where you can, to respond to, or to say are you saying this? They just stare at me. They're just sitting there, just looking around. And I had to almost go to each couple. Are you Mrs. Walker? Are you Mr. Smith? What's happening? Okay. Also, I want to know. So this patient tells my coworker that he was on metformin for 20 years, but now he's allergic to it because he got septic shock. There's so much wrong with that. I don't know. I don't know where to go with that. I can't. Septic shock. That's not how that works at all. I can't even begin to understand how you think that you could get septic shock from metformin after being on it for 20 years. Now you can develop allergies, but I'm pretty sure you didn't get septic shock from metformin. Sepsis is an infection of your bloodstream or an infection in your bloodstream. I don't think metformin can do that now. Were you taking it incorrectly to where you became so hyperglycemic that you set yourself up for infection? I don't know. I got nothing. I can't. I just thank God that wasn't me on the phone while he's telling this too, because I don't. There's a lady yesterday. I'm like, every single time I hear it, this isn't even on my little list, but I have to bring it up. I'm allergic to codeine, but I can take hydrocodone. Well, good, because they're not related. They're not related. They're not the same. What? Because it has co in there. Do you think it's the same thing? Because they're both pain medications? That's not. And I'm allergic to Novocaine. I think he gave me too much. Okay, then that's not an allergy. You had a lidocaine toxicity. That's not. And you can keep saying Novocaine. I've been a nurse for 30 years. In surgery, off and on for 30 years. I've never seen a bottle labeled Novocaine, ever. Not in my dentist office. Not the bottles I'm holding for doctors to draw up in surgery. Never have I seen a bottle labeled Novocaine. And then said, that's not bad enough. She's like, well, I can take xylocaine. Okay, they're all the same thing. A cane is a cane. They're all pretty much the same thing. Is it possible to be sensitive to one and not the other, have a reaction to one and not the other? I guess, but they're all canes, and chances are, if you have a reaction to one, you're going to have the other. Well, my heart did this and this. Well, yeah, because lidocaine is an antidysrhythmic, and I'm sure the other canes would work similarly if given IV. But then we get to her med list, and she uses lidocaine patch. You can't make this up. That's none of what she's saying. It was painful. And of course, it's the last call you make. You're like, I'm just going to make this one call and then I'm going to go home. 38 minutes. She had an allergy list, and most of them were legit allergies. So, it was cool. But she had an allergy list. I think we were on number 14 by the time I had to weed out. And she kept just saying the same things over and over and over. And I'm like, yeah. No, that medication is this medication. You already gave it to me. What else causes you to turn red, itch, or swell? It was torture. It was a long phone call. Yeah, this happens all the time. One of my other coworkers said, you say, "Are you allergic to anything?" "No, nothing at all." "Are you sure nothing ever does this?" "No, nothing." And this was an inpatient. This patient came into the facility, and she's telling me, she's like, "Not allergic to anything at all?" "Nope, nothing at all." "Are you sure none of this?" And then the anesthesiologist comes in with you, and suddenly she's allergic to penicillin. How, how could you misunderstood what the question, "Are you allergic to anything?" was until it was asked the fourth time? How could it have been pronounced differently to where you didn't understand it until the fourth time, or until a different person said the same thing to you? What are you allergic to? Or are you allergic to anything? It's like you're listening to me, right? I know that little Stevie-O guy, he has I just watched yesterday this cute little video where the nurse asks this and asks this and asks this, and he's like, "No, no, 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 no." The patient, is ignoring him. Then the doctor comes in, and suddenly, they'll respond to them and answer all the same questions differently. You're like, "Is that what it is? Is that because I'm a nurse? You don't care what I have to say? Like, I'm preparing all the medications and all of this for you, but you think I don't matter?" Okay, you do realize that I'm the one that's gonna bring that allergy to the attention of the doctor before they prescribe it to you, right? You know that's we're a team, that's how we work. Killing me. Oh, yeah, this patient's always like, "Nope, I've never had surgery before, nothing at all." "You sure? Not one time? You've never been put to sleep?" "Oh, well, yeah, I've been put to sleep." "Okay, for what?" "Well, they blasted a kidney stone." "Okay, you mean in Eswell, you had a extra shockwave lithotripsy? You literally had an extracorporeal shockwave lithotripsy under general anesthetic?" "Okay, yeah, you need to tell us that. That's something we need to know." And then we finally get down to, the next level of questioning. Turns out 2 cardiac stents. But do you think that's not a procedure? That wasn't like surgery, that didn't count? That you're still alive, you survived the stent, so it's, didn't didn't matter? I don't. And then he had a plate in his chest. I asked him about metal, and I don't know why they don't understand this. Metal inside your body is not the same as outside. You can't take away metal that's inside your body. We know that. We understand we're not going to remove the metal from your knee replacement before surgery. That's not what I said. What I said was, do you have any metal on your body? Rings, watches, bracelets, piercings, anything like that we need to know about. Because electric cautery can conduct any metal in your body. Yes, we have a grounding pad, but if for whatever reason that may be, unlikely as that may be, if it failed, we want to make sure that we're not going to electrocute you. He's like, "Well, I got a plate in my chest." But you just said you never had surgery before. How do you have a plate in your chest? "Oh, well, when they cracked it open to do the bypass." Oh my God. Are you saying you've had coronary artery bypass grafting, and you're just now bringing that up? Okay, let me go back up to surgeries and fill all of this in again, and then I have to ask them again. And then sure enough, when we get to something else, "Any thyroid disease?" "Oh no, I had that taken out." "Okay, so you had a thyroidectomy also." Okay, I understand. And then, oh yes, one of my girlfriends wrote this down for me. The patient had a microscopic hip surgery on you, or your bug pet. Did you have microscopic hip surgery on your mosquito friend? Did you have it done on a fly? Maybe you have a worm with hips. Microscopic, like, oh, you mean arthroscopic? Okay, yeah, not the same thing, but still, we enjoy that. That was fun. So you never know what you're gonna get till you get started. And then yeah, I already got some good stuff. When we tell you nothing to eat or drink, no gum, candy, water, mints, and you come in chomping on your gum like a cow, what part of that could you have misunderstood? And they're like, "Oh, the girl didn't tell me." "Oh, the girl was me." And yes, I did. Those are my exact words. I literally say, "No gum, candy, water, mints, nothing at all the morning of surgery." And if they have medication they can take, I'll say, "Well, you can take this medication with a small sip of water, but otherwise, no gum, candy, mints, nothing like that." I don't understand what they don't understand. Now, is it going to make a big difference? Probably not at this stage. At one time, it was suggested that, mints or gum were kind of one of the worst things you could do, because gum and that chewing action, it consistently tells your stomach that something's coming, so the gastric acids are increased. Mints are the same way. Mints are like the worst thing for your stomach, and I live on them, and I have gastritis, and I'm smarter than that, but I still have no discipline or self-control. I love them. I can't help it. So I'm cutting back. But that's detrimental to the lining of your gastric mucosa. And then gum, of course, you're just constantly chewing. What's the rest of your GI tract going to think when you are busy chewing? That's, setting you up. It's a reflex. But the most recent studies are showing that actually, I want to say the anesthesiologist told me that that's actually helpful in the morning because it gets your GI tract moving, so it will help empty sooner. And I don't know if that's going to make it to the US and we're going to abide by that. But as of right now, follow the rules. It's that simple. Yeah, and also if these are the two things patients do, and I can't figure this out. If I do an AccuCheck on you and then I give you the bloody gauze to hold pressure on that little spot just so you don't get a bruise, on your fingertips, that's annoying. Can you not put that bloody gauze on the countertop where my chart is? There are 2 garbages right next to you. There's also one in the bathroom that is right next to you. What would make you think, oh, I'll just leave this bloody gauze right here on the counter here where someone's going to have to come pick it up? You know that I don't want to touch anything bloody from another person without a glove on. Are you really going to make me go get a glove to pick that up to go throw it away when the garbage is right? Like, what would make you think or they hand it to you, here, I'm done with that. Okay, there's a garbage can right there. Did you see it? You're touching it, like your foot's touching it. Is there a reason why you would give me your bloody gauze? I mean, what would make you think I'm going to take that from you? I don't. Or the urine, come out of the bathroom, handing me your urine cup. I'm not going to grab your urine cup out of your hand. And could you not put it on the table next to the chart also? You're in the bathroom already. Why would you leave the bathroom with the urine in your hand? There's this wide area behind the toilet where you could have left it. You can leave it on the sink. Like, why are you handing it to me? And if you think that magical paper towel around it makes me want to hold it all the more, I'm not going to. I'm not touching the urine cup. Stop it. Just put it on the back of the toilet where I told you to leave it when I told you we needed a sample of your urine. And then, this patient wrote in that they had explant surgery. Was explanted. What was explanted? I have no idea, but it was explanted. It wasn't removed. They had explant surgery. I'm very curious to see what that is. I don't know that I ever got to talk to that person. Oh, dear Lord. And then the guy I talked to yesterday, this was so painful. God bless him. Okay, so have you ever had MRSA? Well, I don't even know what that is. All right, that's fine. So have you ever had surgery? Well, the most recent one, no, I didn't ask for the most recent one. I asked if you've ever had surgery. I had surgery in May. I had these blood clots in my lungs, both sides. Oh my God. You had bilateral PEs? Oh, is that why you take the Eliquis? There's no T in Eliquis, but they all added in there. I wonder if I could get them to take the T out of Eliquis and Alzheimer's. Take the T out of Alzheimer's and put it back in mastectomy. Because if I hear one more time, even on the news, they talk about, they say they all had a mastectomy. Oh, where was the mass? Oh, you mean a mastectomy, which refers to your breast? That's what mast is, your mastectomy, like mastitis. No. So he's on the Eliquis because he had the bilateral PEs. Any other surgery? No, not really. It was so far back it doesn't even matter. You sure? It's because you're only 60. Like, I talked to an 80-year-old that had surgery when he was 9 and told me about it. So I think we're within reason here. Oh, well, I had something come up on the back of my leg, and I had to spend 3 weeks in the hospital, and they had to cut it open and drain it and clean it out. You mean you had an IND of an abscess in your right calf? Is that what you're saying? Yeah. Was it MRSA? Yeah, I think it was. Didn't you just tell me a minute ago that you've never heard of MRSA? And now you spent 3 weeks in the hospital with IV antibiotics? Okay. Is someone punking me? Like, what? You don't have to be a doctor or a nurse or any sort of medical professional to understand that what you're saying makes no sense. Imagine if that's the way you talk to your mechanic. If you went there and they're like, it's making a click, 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 click sound. When? I don't know. Where? I don't know. Oh, by the way, it won't start. Like, I don't understand how, and they probably go through the exact same things. By the way, he also had back surgery. You mean your spine? Like you had spine surgery? They worked on your back, that like the number one risk of back surgery is paralysis, and you just weren't going to mention that? What'd they do to your back? Oh, they cleaned it out. Oh, you had the old back clean out. Yes, right. Clean it out. No, that's not a thing. We don't clean out backs. What did you get in there? Glass? Did you fall on broken glass? And that's what happened? Were you dragged by horses and the gravel was filled in your back? Okay, if you're talking about your spine, you should know what you had done. Did you have a lumbar laminectomy? Was it a discectomy? Did you have a fusion? What was the problem? He had no clue. He's only 60. I mean, that, like, I'm 11 years away from 60. 60 is not elderly. 60, you're still at work. Like I, you're not 94. I don't understand how you don't understand that is important. Oh God! And then this sweet little girl, she says, and I guess this happens. My coworker told me this happens all the time. They don't read the questions, and I guess some of them can be misleading. I get that, but the question is simply, do you wear glasses or contacts? And then there's a little box where it says, please specify, which ones are both. And she writes in there, glasses to make me see more clearly. That's the only thing glasses do. I mean, we weren't asking about sunglasses. Glasses make you see more clearly, whether it's for close up or far away. That's why would anybody write that in? I don't understand why you would even write that in. Sweet little girl. And then she wrote, under allergy, she wrote Omnicef. And then for reaction, she wrote NA. Your reaction is not applicable to your Omnicef allergy. That's not what NA means. You guys understand that, right? Like, I know some people use words incorrectly because they don't know what it means, like Joey, when the point is moo. But this seems like you should be smart enough to understand that if you think you're allergic to something, you need to tell me what happened when you took that drug. And sure enough, she turned red. That's a legit allergy. Like, it was good that she put that in there. But NA, if you mean like, I don't know, or I wasn't sure, but that doesn't make any sense that when I questioned her, she suddenly did remember. I don't understand why. It's going to be my next segment. Why? I'm just going to do that. And then this other patient, the last patient of the day that I spoke, well, the second last patient of the day, the penultimate patient of the day that I spoke to, said that under her allergy, she wrote drug. Like, there's a box where you can write in what you're allergic to. She wrote drug. And I think she was a nurse, because very few laymen say that they had a TAH-BSO. So she wrote in that the allergy was drug and the reaction was Cipro. This is a medical form. Can we pay just a little attention to it and maybe fill it out correctly? I may need a vacation. I love my patients, and they have no idea. I would never make it obvious that they're making me want to kill myself. But that was a tricky kind of go there for a little while. But same as always, face your fears, forget your failures, follow your faith, and until next time.